Typically, lymphoma and leukemia are among the most common blood cancers that are linked with night sweats. These cancers generally occur with further symptoms, including unexplained bruising, weight loss and fatigue. Whilst night sweats are most commonly an attribute of hormonal alterations in premenopausal and menopausal women, which take place periodically, those connected to blood cancer appear to be persistent. According to Blood Cancer UK, those with constant, drenching night sweats to the point where it may be required to change clothing should seek medical advice from their GP. Out of more than 2,000 leukemia patients asked in a Leukemia Care survey, 31% reported night sweats as a major symptom before their diagnosis. The Blood Cancer charity adds, "It is all too easy to dismiss an increase in night sweats as just a harmless symptom of summer. Symptoms were things you would see in a normal baby." Ashley Kane issues advice to parents. According to cancer research organizations, the predominant reasons as to why blood cancer causes night sweats are down to the body attempting to fight the cancer. As the cancer persists to cause a fever, the body will produce excessive sweat in an attempt to reduce body temperature. In treatment cases, night sweats will continue to occur even when patients are receiving cancer therapy due to the reaction of treatments such as chemotherapy and hormone levels. Chronic lymphocytic leukemia, CLL, is most common in children and young adults, affecting 4,500 people each year. Pamela Anderson Health, Stars Death Sentence, Symptoms, Insight B12 Deficiency, 4 Symptoms in Hands, Legs and Feet, Tips Dementia, 3 Lifestyle Habits that Raise Risk, Advice. Most of the signals encountered by those with CLL are associated with the lack of healthy blood cells caused by an overpopulation of abnormal blood cells that are not fully developed, known as leukemia cells or blasts. CLL generally begins in the bone marrow and can spread viciously if it is not seen too early on. Night sweats alone are not usually due to a serious underlying health condition such as blood cancer and can be associated with numerous conditions such as anxiety, low blood sugar and alcohol or drug use. However, an individual should seek medical advice if they continue to experience persisting night sweats, especially if it is connected to other symptoms. Over 40,000 people are diagnosed with a blood cancer each year in the UK, and over 250,000 people are currently living with blood cancer. The scope for CLL varies on how advanced it is when it is diagnosed, how old you are when diagnosed, and an individual's general health. Normally, about 7 out of 10 people will survive their CLL for 5 years or more after being diagnosed. However, healthier and younger people who are diagnosed when CLL is still in the early stages generally have the best chance to survive the disease. Although it cannot generally be cured, treatment can help control CLL for many years. The treatment for CLL, and other forms of blood cancer, happens in stages. The primary stage is set out to kill leukemia cells in the bone marrow in order for healthy blood cells to resurge. The second stage is designed to stop the cancer reforming in the bone marrow and is done through stages of treatment. The exact treatment depends on which type of blood cancer is present, but chemotherapy is usually the main part of the treatment for cancers such as CLL. Related articles: Cancer symptoms, main symptoms of the disease to spot bowel cancer symptoms, what to look for on your loo paper, how to live longer, Rooibos tea to boost longevity.